I'd like to welcome everybody to tonight's presentation with Dr. Adrian Wax from Dana-Farber's Breast Cancer Group. The title of the talk is an introduction to the management of HER2-low breast cancer. And with that, I'll turn it over to Dr. Wax.
HER2-low breast cancer, of course, is this really relatively new but now actionable subtype of breast cancer, which is not HER2 positive. The definition of HER2 positive hasn't changed. These are patients who are not HER2 IHC 0, but they're the group that falls in the middle of that. So HER2 IHC 1 plus or 2 plus with a negative ish test. And this is not a small subgroup of breast cancer. This is actually more than half of breast cancer that falls into this HER2 low category. So it's a big subgroup. And obviously, the reason that this is now on everybody's minds is because of the DESTINY-Breast04 trial, which we saw presented at ASCO last year and compared T-DXd with investigators' choice of chemotherapy in metastatic HER2-low breast cancer and showed PFS improvement in the hormone receptor positive HER2-low cohort from 5.4 to 10.1 months, and then among all patients, a PFS improvement from 5.1 to 9.9 months. A couple of important things to note about this trial. So most of the patients, 500 of them, were hormone receptor positive HER2-low. Only about 60 were hormone receptor negative HER2-low or triple negative, although it did look like the results still held if you looked in that triple negative subgroup. Patients that had 1 to 2 prior lines of chemo. These are the chemos that were allowed or used in the control arm. So about half of the patients got eribulin, but there was a breakdown otherwise between capecitabine, Abraxane, gemcitabine, paclitaxel. And also importantly, an overall survival benefit was seen in the hormone receptor positive and the overall population. So based on these exciting results, this treatment, T-DXd for HER2-low metastatic breast cancer, was FDA approved back at the very beginning of August 2022, pretty much exactly 2 months ago. So now, as of just these past couple of months, we have this as an exciting new option for our HER2-low patients.